Getting started. Today's webinar is entitled Recruitment and Retention of School Mental Health Providers, Part 2, Innovative Strategies. And if you missed part 1 of our series, don't worry. You will be able to follow along well on today's webinar. You will also be able to check out the recording and the slides from part 1 of our webinar on our website if you're interested in seeing what you missed. And as a SAMHSA funded center, I have to provide a disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. And again, I'm so excited about today's webinar. We have 2 fantastic guest speakers, and they're going to be providing some information so that we can achieve these learning objectives. So at the end of today's presentation, you'll be able to describe creative approaches to recruit school mental health providers, examine successful strategies for retaining school mental health providers as applied by experienced school mental health provider organizations, and you'll be able to identify funding and strategic opportunities to sustain the school mental health workforce during and after the COVID-19 pandemic. And now I have the pleasure of introducing you to our guest speakers for today's webinar. So first, we're going to be joined by Nikki Raymond. Nikki has been working in community mental health for over 2 decades. She has a master's degree in psychology and an MBA in leadership and management. Nikki's the CEO of Georgia Hope, which is a community-based mental health, substance use, and family preservation services provider. Under her leadership, Georgia Hope has expanded their footprint by more than 5,000%. She's also a fellow in the Robert Wood Johnson Interdisciplinary Research Leaders Program, and she's truly a leader and an advocate for increased access to services for vulnerable at-risk populations in Georgia. Recently, she was appointed to the advisory board for the Governor's Office of the Child Advocate in the state of Georgia. We're also going to be joined by Dr. Mark Sander. Mark earned his doctorate from the Minnesota School of Professional Psychology in 2000. He's a senior clinical psychologist for Hennepin County and the director of school mental health for Hennepin County and the Minneapolis Public Schools. Mark coordinates the Minneapolis Expanded School Mental Health Program and conducts research and evaluation on this program, as well as technical assistance to the Hennepin County School Mental Health Initiative. Mark is a certified master trainer in the Adverse Childhood Experiences Study, and for the past 4 years has been providing training and consultation on trauma-informed organization and trauma-sensitive schools. Again, I could not be more excited about the content that they're prepared to share with you today. And I'm now going to turn it over to Nikki to get us started.
Good afternoon, everybody. Let me go ahead and share my screen. Dr. Cummings, thank you so much for that introduction and for allowing me to share a little bit from my school-based heart today. As you can see, I'm going to be talking about recruiting and retention in school-based mental health. Just to give you a little bit of an overview about how school-based mental health works in the state of Georgia, it's basically a partnership between the Department of Behavioral Health and Developmental Disabilities, contracted providers, and schools. Georgia Hope was lucky enough and honored to be awarded funds through the Department of Behavioral Health back in 2015. And so this is a state level program that provides funds to mental health providers. And we started with 2 schools. We are now in 2020 in over 150 schools. We cover multiple counties, mostly in rural Georgia. The APEX model pretty much staffs each school with 1 clinician and at times a paraprofessional. There are times that we add additional staff to a school depending upon the caseload. We've seen a lot of success in our school-based mental health programs, which has allowed us to grow. And with the tremendous amount of growth, as you can see here, as the number of students grow in our program, the number of staff required to provide support to those schools grows as well. But with the tremendous amount of growth, obviously our recruiting and retention efforts need to increase as well as improve. And we have to do that in the midst of a time when there's a critical shortage of clinicians nationwide. And so that's why we're talking today about our strategies to recruit and retain qualified school-based mental health professionals. We really do hang our hats on this statistic here at Georgia Hope. We have a 97% retention rate here, or the inverse of that would be, a turnover rate of 3%. I've seen statistics that support turnover of between 30 and over 50% in our industry, which can be very detrimental to the clients that we serve. And so not only do we need to focus our efforts on recruiting and retention in a field with high turnover and a low, a shortage nationwide of clinicians, but we have to do it oftentimes on a shoestring budget. And so I want to talk about the strategies in which we do this. And I've broken this out into 3 overarching strategies. The first being leadership philosophy, the second being compensation related strategies, and the third being organizational strategies. I'm going to cover the Georgia Hope way, but I'm sure a lot of this will not come as a surprise to you in your organizations or in your partnerships. I think it's important to always start with your leadership philosophy. I believe very strongly that you should never be too far to hear the voice of your people, and your people include stakeholders. It's really the voice of your people that should drive the success of your recruiting, retention, and program. The way in which we do this to stay in tune with the voice of our people are things like surveys, often town halls, pulse calls, really just picking up the phone, calling people, how are you? How are things going? How can we do better at supporting you? Staff meeting drop-ins. We do things that are called road shows, which is literally our senior leadership team goes on the road pre-COVID, now virtually, and checks in with our teams and demonstrates our accessibility and our desire to hear the voice of our people. We do a lot of acts of gratitude, handwritten thank you notes, shout outs, staff appreciation day, and so on. I think it's really, really important that people in your school-based mental health program feel that the leaders in the organization are champions of school-based mental health, not just community-based mental health, not just mental health. That's not enough. You need to be a true champion of school-based mental health. And as I said in the beginning, I share this with you for my school-based mental health heart. I mean it. I have a true passion for school-based mental health, and I recognize that it's separate and different and unique and special from all other community-based type programs. I believe strongly that if you keep retention as your North Star, you'll be successful. And that seems really intuitive, but really what's important here is not intuition, but rather your intention. Your intention around recruiting and retention strategies. And let's go ahead into our next type of strategies, which is our compensation related strategies. So as I said earlier, it is really detrimental to any clinical relationship if it ends prematurely, if it ends before the client is ready for it to end, or before they have achieved whatever goals they have set for themselves. And so this is especially important during the school year. We want to make sure that when a clinician starts with a school or a client at the beginning of the school year, they see it through to the end of the school year at least. And so we put some incentives in place at different benchmarks throughout the year to ensure that they remain with the company and at the school. We have at times done a 3-month, and then after 6 months, and then at the end of the school year. And we've seen that be very successful at Georgia Hope. We also have a different and separate pay span for those who are school-based mental health clinicians and paraprofessionals. We see this as requiring a different skill set. If you can imagine, each clinician assigned to a school as sort of an entrepreneur, having their own baby, their own company, if you will, with that school. They have to have a different skill set. They have to have the interpersonal skills to maintain those relationships with the school partners. They have to be really good at marketing. They have to have really great communication skills in that they have to deliver not only intervention ideas and concepts, but also information around policies, procedures, protocols, how to make referrals, so on and so forth. They also have to have, of course, their clinical skills, and they have to be really creative. When you're working with schools, particularly elementary schools, creativity is of utmost importance. You have to know how to reach people. And so for that reason, we see it as a different skill set and a different pay span than our other community mental health work. If you're in a rural area, there is the National Health Service Corps Federal Loan Forgiveness Program that you may have access to and you may be interested in. I would look into that. There are certain qualifications you need to meet in order to become an NHSC site, but I'm happy to provide the information here at the end, the website to apply to become a site. I want to move now into some organizational strategies, and something to keep in mind here is I've had the chance to preview the report from Dr. Cummings and colleagues at the Southeast MHTTC that they prepared on recruitment and retention strategies in the school-based mental health workforce. Dr. Cummings presented this at her webinar on December 2nd. For myself, I thought the report was really great, and it aligned somewhat seamlessly with a lot of the strategies that I'm talking about today. But in particular, there was a large section in the report that described organizational strategies, much like what I'm going to be talking about. Talk about data sharing. They talked about career advancement. And so I'm going to be talking about that as well. So if you haven't seen it, that will be available to you, and be on the lookout for the report that's coming out soon. So as far as organizational strategies at Georgia Hope, I alluded earlier to not just being intuitive about how to recruit and retain people, but more so intentional about it. One of the ways that we're very intentional organizationally is that we have an entire department dedicated just to recruiting and retention for the agency. Surely if you have a group of people, you have a brain trust there that will come up with new and innovative strategies to recruit and retain. And having that dedicated department, you can almost ensure that that will happen. I think it's also really important to raise the organization's public profile. Stay ahead of the curve, be in tune with what's happening on a state level, what's happening in the industry, get your program and your name out there so that not only will you get feedback, but also you can be on the front line of learning new strategies, whether it be about recruiting, retention, or just about school-based mental health in general. very important. And also, I talked earlier about this nationwide clinician shortage. And so we really invest a lot of resources into hiring unlicensed clinicians and interns. If your payers will allow you to use unlicensed clinicians, I would 100% consider investing in a lot of resources around them. Fortunately, we've had about a 90% conversion rate from interns to employees. And so if you really start, from the beginning of their careers and help them through it, you'll find that you can increase not only recruiting, but retention. So in that same vein, staff development is something we focus on as well here at Georgia Hope. I'm sure many of you know who are in the mental health field, there are a lot of continuing education credits that are required for licensure. And so we work very hard to provide all the CEU opportunities within our agency. We became a CEU provider purposely for that. And so we offer the number of credits per year and then some that are required for the continuation of licensure or the attainment of licensure. We also focus a lot on leadership development, not even necessarily for those to be on more of a management track, but just really bring out leadership skills. Again, just thinking about school-based mental health as an entrepreneur opportunity when you're assigned an entire school and an entire community partner. We also really maximize on our training curriculum, meaning set them up for success. Tell them ahead of time, what are the barriers to a successful school-based mental health program? How important is it to get to know the front desk staff, and how do you go about doing that? Those are the types of things that are tried and true, lessons learned in school-based mental health that you can share with your staff, and it's important that they have that ahead of time, right from the beginning. Data sharing with the team. So as it relates to recruiting and retention, it's very important not only to collect the data, but to share the data. So we look at things like how many candidates are coming to us, how many of those candidates convert to interviews, and how many of those interviews convert to employees. And we examine the narrative behind every single point in that process. What do we need to tweak? Are our recruiting ads calling people? Are our compensation packages competitive that we're putting out there where we're seeing conversions from interview to hire? And then also data around our referrals, our number of schools. Those are things that are helpful to not only our recruiting and retention departments, but also the staff who are working in the school-based mental health program. There's a certain level of buy-in that's created when you share the data that wouldn't otherwise be had you not. I think the last thing I just want to share about is telehealth options. I wrote here early adapter versus current day. We were a telehealth early adapter, and I have to tell you, I didn't have the best experiences trying to sell a virtual school-based mental health program pre-COVID. But I have to say now, during COVID, it's been extremely helpful to our schools who are open to that strategy, and particularly for our staff, obviously that there's a certain level of safety not having to go into schools if the schools are even open. So looking at telehealth moving forward, especially in rural areas, I imagine there will be a lot of people who will show continued interest in a virtual school-based mental health program. And I believe that that will be a continued retention strategy for for our staff. So thank you again for allowing me to share my school-based heart and some of our recruiting and retention strategies. I have been told that I can answer questions here at the end, and I will turn it back over to my colleague, Dr. Cummings, to introduce Dr. Sander.
Thank you so much, Nikki. That was fantastic. I'd like to encourage all of the viewers here, if you have specific questions for Nikki, go ahead and drop those in the Q&A box, and we're going to be monitoring those as they come in, and we're going to be doing Q&A at the end with both Mark and Nikki at the same time. And so now I am very excited to hand it over to Mark Sander, who is going to talk about some innovative approaches that they're doing in Hennepin County in Minnesota.
All right, I think we're ready to go. Thank you, Dr. Cummings and the Southeast MHTTC. I'm going to talk about this from a little bit broader perspective and talk about some of the work that we've done here in Hennepin County, but it's really exciting to see how much overlap there is with some of the strategies that Nikki talked about. So the first—
Mark, just a quick question. Can you switch to switch the view on the slides so that
sure.
the slide show view?
It is not. It is showing up that it's.
Thanks so much.
All right. Do you have it now? Is it showing the right?
No.
No. Hang on.
You go to slideshow, perhaps?
Yep. Well, and it's showing up on one of my screens as a slideshow and not here.
Yeah, the slideshow tab at the top. There we go. Great.
All right. Awesome. Sorry about that, folks. All right. So again, like we've got a lot of overarching themes. So one thing that I'm going to talk about is a coalition of stakeholders that came together starting back in 2008 that really jointly developed the mission, vision, and policies and practices around school mental health. And as I thought about the work of over 12 years of this group coming together, it really has helped booster our efforts around recruitment, because we're really clear about roles and responsibilities across all the schools that we're in. And we've got now more than 18 different mental health agencies doing this work in Hennepin County. And I think it's also really increased our retention rate because of increased job satisfaction, a sense of being a part of a larger initiative, and less feelings of isolation. As Nikki talked about, being in a school and kind of, that being your place to be and work. Sometimes you're isolated from other clinicians that are doing the same or similar work to you are. And so we'll talk about some strategies to help combat that. And then a consistent framework for school mental health has really allowed our other stakeholders, school districts, NAMI Minnesota, other folks come in and help with different components of recruitment and retention. All right. All right, so Hennepin County, we started our school-based mental health program in 2005. We started in 5 schools. Even back then, it was a partnership between Hennepin County, the Minneapolis Public Schools, and 2 mental health agencies. And then in 2007, the Minnesota Department of Human Services got interested in our model to help them further develop their statewide framework for a school mental health grant program. And we're going to talk about how that plays in a second. So like I said, we, back in 2008, started as we expanded with 4 agencies, Hennepin County school district leaders started meeting on a monthly basis just to share successes, challenges, and their experiences working in the schools. And I think as Nikki was talking about earlier, having those stakeholders really coming together was super important in co-creating the program and understanding how we can support clinicians in the buildings. Currently in 2020, we have 18 mental health agencies serving 17 different districts and over 145 schools just in Hennepin County. And then you can see at the bottom here, we started meeting as a group when the state grant program came out, and you can see how that grant program has grown over time. And from the standpoint of recruitment and retention, these stabilizing funds, which really help pay for the ancillary costs, the teacher consultations, doing work around copays and deductibles, and really being fully integrated into the building has really been create a stabilizing effect for our staff and the program. So coming back to this collaborative group that was coming together, why was this important for us? And especially, we were early on in developing school-based mental health, but we really created a collaborative culture in that meeting where there's a lot of trust and transparency. We established values and norms around the school mental health work, and then over time, agencies shared their different models of how they were doing the work in their different buildings. That led to developing really a culture of school mental health in Hennepin County. In 2012, we created this consensus statement on what this group felt school-based mental health was and looked like. And that was really important so that our clinicians and our schools and our school districts could really be clear about what is the work that they're going to be doing and how is this work different than school social work, right? And so having that consensus statement really allowed the group to think about some innovative strategies that we'll talk about in another slide or two. And then one thing that this group did in 2015 was really state that we need a minimum of a half-time position to do the school mental health work the way that we imagine it. It isn't just putting a therapist in the school. It's really talking about that person who is really integrated into the building, serving students' mental health needs, but also consulting with teachers and other school staff to create a safer environment and really promote mental health awareness and literacy. And in all of this, we've got to remember that these mental health agencies are collaborating in a competitive environment. And so again, we'll kind of talk through some of the ways that we've navigated some of that. So, Nikki was talking about that she got to view the report. I also got to get a sneak peek of the report from Dr. Cummings and her staff. And I just really want to say that I'm really appreciative of it. And you're going to see how a number of their strategies really line up with some of the things that we were already doing out there. We'll talk about, the early career pathways that, both myself and Nikki and the report talks about, and also developing a unique school mental health focused onboarding experience, what I'll talk about here a little bit later. So again, I think the report, when it comes out, which I think is going to be in a couple of weeks, maybe in the beginning of January, I would highly recommend reading it. So from this collaborative work, there were some collaborative strategies that kind of got talked about and brought together by these agencies coming together. So one of them was just like you said, talking about challenges and successes, maybe working on some joint projects together. One thing, we talk about it as the summer slump here. Sometimes in the summer, we're just not able to engage as many families. And so that led to talking about, well, what kind of work can this group do together to keep, can we do some professional development in the summer? They also, out of this, talking about this for a while, came up with some new creative ways to offer different staffing approaches. So for some of the clinicians, they would really like to work part-time in the summer. And so one innovative thing that came out of this group really sharing this information was think about, well, during the school year, you're going to work, full time, but then in the summer, you're going to work maybe, let's say, 0.5. And so overall, it's a 0.8 FTE. And then these agencies shared, how they were solving some of the HR benefit and different issues. So again, coming together really was allowed them to leverage, because we've got some small agencies, and then we've got some bigger agencies that have, much more HR kind of horsepower in them to help think through some of these ways to approach and support staff in being in the building. Again, this consensus statement was so important because when we came in to the buildings, we want to be very clear about what the work is so that there isn't any role diffusion or lack of role clarity. So those staff who are often are on their own in the building can really feel supported and clear about what their role is. And one of the things that we do, because our clinicians get so connected to their school, want to really understand, how school works. And for a lot of us in the mental health field, we weren't trained in understanding how things work in school. So we've done a lot of cross training about due process, about multi-tiered systems of support, about social emotional learning, more recently about equity. We actually had a meeting with over 350 school psychologists, school social workers, and our clinicians talking about what does it mean to be an anti-racist mental health team. And so we had a couple hours on that. So again, this really helps the clinicians feel a part of their school and feel supported, which I think just leads to more job satisfaction and a lot of fulfillment in doing the work. Another reason why we do these clinician meetings is so that these clinicians from other agencies can really meet with each other and feel part of a bigger mission. We talk about, kind of the Hennepin County School mental health work as an initiative, as a program, but being part of a bigger whole. And then, as the report talked about, and we're working on it right now, some of our agencies talked about there's a lot of time and money spent on onboarding new staff. I think we've got about 145 FTEs across Hennepin County doing school-based mental health. So that's a lot of people. And so we talked about the agencies really doing their agency-specific HR onboarding work, but that because we've got this consensus model of school mental health in Hennepin County, actually the different mental health agencies could take on onboarding different clinicians on school-based mental health like in different quarters. So, that's something that we're working on. Again, it helps us really stay clear about what the work is and what the model is in Hennepin County, but also provide some cross-agency collaboration and fun. So what are some of the organizational strategies that are going on here? I think, right, Ms. Raymond talked about the importance of there's a different set of skills when you come and work in a school. And so and it's not just being a really good clinician or a therapist, there's other additional skills and qualities. So one of the things that our agencies have done is really talked about what are those different dimensions. And they've talked about, kind of sharing different job descriptions to really hone in on, in addition to being a really good therapist, what are the other necessary skills? And I think that's led to better retention. Because the therapist is really, the clinician's really liking the work. It's a good fit for them as well. And then they're being successful in the schools. There's also a lot of individual and group supervision and support that I think really helps that sense of community and also kind of really helps with some of the professional development and growth about how do we keep the work fresh in schools. And then I think the other thing that's important is making sure that the supervisors aren't just staying at the agency, that they're going into the school, they're building relationships with the principals, with the student support team, to make sure that if there are bumps that come up along the road, that we've got enough relationships to really help support the clinician. And I've already talked about this a little bit, but teaming as a retention strategies. People are feeling, so connected to their schools. So really at those, we've got the district level team meetings, so making sure that we've got consistency of the program and expectations across schools. And then in the schools, we have what we call our school-based mental health teams. And this is a vital, and especially during COVID, where up here in the Twin Cities in Minneapolis, St. Paul, a lot of our schools are still distance learning. And so these teams have been vital, I think, to helping the clinicians feel supported, and also that they've been able to give support to their schools and reach out to students and families. Career pathways. Again, there's a lot of overlap with what Nikki shared. Leadership opportunities are really important, and creating those pathways for career growth. And so a number of our agencies have gone from like 1 or 2 schools. Now they're in 22 or 23 schools. And so they've got a whole, kind of department or division in their agency with opportunities for growth in doing supervision, maybe in doing some more professional development to support clinicians. So just opportunities for people to grow different ways there. The importance of developing practicums, internships, externships, this early pathway so that clinicians understand there is a career for you in schools. Again, a lot of our graduate and undergraduate programs don't really highlight school-based mental health as a viable career. And then in Minnesota, we've got a state grant program that really is focused on the recruitment and mentorship of diverse clinicians and different cultural clinicians. So that's been a really important pipeline to get more clinicians of color and clinicians speaking lots of different languages into our buildings. And another piece is just this recognition. Because we have this Hennepin County School mental health work, we've been able to, this work is recognized by the University of Minnesota, has been recognized by the National Center as an exemplar program. And I think that builds some pride and excitement about being part of, and so when we go out and are recognized for some of these awards and recognitions, we try and make sure that we talk about all of the partners that are part of this work because they're all vital. And then just some things related to COVID. I mean, obviously we're living in this time of COVID, and we were talking about, earlier, the pivot to telemental health. In Minnesota here, we in last March had to quickly pivot because we were on a stay-at-home order. And so our agencies had to very quickly figure out how to stand up telehealth. One thing that our Minnesota Department of Human Services said was you could also use cell phones to do teletherapy. They were allowing e-signatures so we could get some of these consents and releases of information signed, which was critical to keeping the workflow and keeping communication between school, client, and clinician. And then creativity around the grant support to make sure that agencies, where we were finding it was taking sometimes a little bit longer to connect with agencies, making sure that they had the financial support so our clinicians weren't getting burned out. Again, that's a huge retention component here. And then the Minnesota Department of Human Services started having some bi-weekly meetings just to talk about how are things going on across the state. What are they doing, creative ways to support their staff? And they were doing, kind of some drop-in self-care sessions, thinking about innovative ways to, you know, I was actually just talking to a staff person yesterday, and they are driving out as a supervisor. She's driving out to each one of their employees' homes and dropping off a surprise winter gift, just to say how much they appreciate all the hard work they're doing. And then we've had some CARES Act funding that's been helped support. So some of it was these family first support, where clinicians, especially clinicians with young children at home, will be able to do some more flexible hours and get some support there. We've also got some money that came out so that our clinicians could spend more time delivering outreach to parents and caregivers, and not having to focus so much on the billable hour right now, and that and being able to increase, you know, ancillary supports for school staff. We're just hearing so much about how school staff are also feeling really stressed, and I think our clinicians really appreciate being able to support school staff as well during these challenging times. So I just want to say thank you to the Southeast MHTTC. I also want to acknowledge the Minnesota Department of Human Services, Minnesota Department of Education for all their support in school mental health here in Hennepin County. NAMI Minnesota, Sue Abderhold and her staff are great champions of school mental health. I want to thank all the schools and school districts and providers across Hennepin County. I want to thank my Hennepin County itself for supporting me in this work, and also want to thank IKEA for their recent donation to school mental health in Hennepin County.
Thank you so much, Mark. I'm gonna invite Nikki to unmute herself and join us on camera as well as we transition to the Q&A portion of this. And Mark, if you could stop screen share, and then I think all of us will appear on camera. Thank you so much. Both presentations were just absolutely fantastic, with so many nice examples of concrete strategies that are being used in the field to help with recruitment and retention. And I'd like to, before I kick off the Q&A portion of this, I just want to share with everyone that the report that's been referenced throughout the presentation, it is currently being finalized by our center, and our plan is, once it is finalized and published, we will be emailing a link to the report to all of those who registered for today's webinar. So stay tuned for that and keep a lookout for that in January. We anticipate that will be published by the end of January. So for the Q&A portion, Nikki, we had a question come in, and I was wondering if you'd be willing to elaborate a little bit further and say a bit more about how your organization uses unlicensed clinicians and what the funding sources are for these positions.
Sure. So the funding sources in Georgia for school-based mental health are through the Department of Behavioral Health and Developmental Disabilities. They have the APEX grant that provides some seed funding for developing the actual model and programs. And then there's also 3 care management organizations, well, 4, soon to be 3 care management organizations through the Department of Community Health. And so through them, it's basically outpatient billing. And so we are reimbursed for different practitioner levels, one of them being practitioner level 4, which is for a clinician with a master's degree from an accredited college or university on licensure track. So we are required to provide clinical supervision or ensure that they are being supervised by a appropriate credentialed clinical supervisor. And so, and they have to sign an attestation. We have to collect information on the clinical supervision hours and attendance. So there is probably a lot more oversight of the unlicensed clinicians than there is over licensed clinicians.
Great, thank you. Oh, I have a little bit of feedback there. I had another question for you. Your organization has been so successful in growing, and you're quite large. And some of those who are tuning in today may be part of organizations that are smaller. So, are there any strategies that you can think of that your organization is implementing that you feel have really helped with recruitment and retention that may not, that could be successfully implemented by organizations of all sizes, small, medium, or large?
Well, the way that the school-based mental health program in the state of Georgia is set up, given the payers and the payment structure, it's a fee-for-service payment structure. And so that allows the program to be scalable regardless of your size, right? So if you get reimbursed for therapy and you have the ability to do what they call out-of-clinic billing, what stops you from doing it in the school setting? And so you also want to consider what the breakdown of billable hours are for your staff compared to administrative hours. So we look at it usually a 65-35 or a 70-30% breakdown, whereas the larger percent is billable time with clients. And then the remaining is providing support to the school, the teachers, time around developing relationships, trainings, all the administrative components of the school-based mental health model.
And I would just say that that's very similar to how we've structured it here in Hennepin County in Minnesota, where there's about 65-35 or 70-30 split. I think that's where the state grant funds can be really useful, but we've also got some school districts that are purchasing that. And then, like we talked about, that just really allows those therapists to embed in the building and feel really connected to the building, which I think just, allows them to just really kind of love what they do. And then I would also say, related to kind of the master's degree but unlicensed, we've got a similar kind of payment structure here in Minnesota. Particularly for public insurance. Sometimes the private insurances don't cover it quite the same way, but yeah.
I second that.
And the next question I'm actually going to pose to both of you, and I'd love to hear both of your perspectives, because one common theme that I heard was the importance of listening to what's happening on the ground and getting some really good ideas related to recruitment and retention by developing trust with your staff, with stakeholders, and just hearing what ideas they have. So I'm going to pose this question to both of you. Feel free to jump in, whoever would love to take it first. Nikki, for you, can you think of an example where being close to the staff, you heard a unique idea or perspective that really was translated into a tangible strategy related to recruitment or retention? And similar question for you, Mark. You mentioned that you were able to hear from clinicians in the collaborative work that you're doing, but any other time you can think of where creative strategies really came from the ground up rather than a top-down approach?
Yeah, I mean, I'll try first. I think the compensation related strategies that I briefed on earlier really came from our people, either as they were leaving in an exit interview or prior to, not just around how school-based mental health is separate and different, but also, staying throughout the year, which is where we came up with the bonus incentives throughout the year, and also a separate compensation plan for school-based mental health staff. I mean, I think until there is, and this is just a bit of a pivot, but until there's parity, between mental health and physical health, we are going to see difficulty having competitive compensation packages in our industry. That's just the reality of it at this time, particularly when you're working with public funding. And so I recognize, and that's why I want to emphasize that there are more organizational strategies to put in place than there are compensation strategies to put in place around recruiting and retention for that reason. I hope that was helpful.
Yeah, and I think
Great.
the idea around I think compensation and also just kind of working, what does the work look like over the course of the year? I think giving clinicians, so what we've heard from a number of our agencies is that flexibility. So in the summertime, can the work look different? And some people want to work more, and so there's ways to do that. But I think there's a flexibility there that I think people who are drawn to school-based mental health kind of like that flexibility, and so I think being able to keep bringing those opportunities up to talk about, are there different compensation models? Are there different kind of hourly models over the school year? What is it that you need or want to kind of stay in, to really stay committed? And I think we've found, like Nikki said, when given those opportunities, there's a lot of staff that have a lot of really interesting ideas and also just really appreciate being heard.
I have a couple of questions that have come into the chat box. Mark, do you have you experienced problems working collaboratively with different organizations within the same school district? So if you could,
Sure.
talk about any challenges and strategies to address those challenges.
Yeah, I think it is. I think I think what we've tried to do is from the beginning kind of co-create what the model looks like, and so that the agencies are all on board. And we started when we had 2 agencies. Now in Minneapolis Public Schools alone, I think we have 10 different agencies that we're working with. And so there is that culture and coming back to like recommitting to the values, recommitting to the model, but also being able to have some flexibility. And then I think the other flexibility where maybe differences make a difference, maybe given a certain cultural population. I think the other thing for me is having a district. So the associate superintendent for the Minneapolis Public Schools, one of them, is co-managing this work with me. And so we've been pretty clear about kind of the expectations and the vision, while still being able to create space for co-creation with agencies. And then quite frankly, we have put it all in writing. We've got, contracts that are pretty clear what the expectations are. So I think for the most part, and then we try and do the work together. So we try and apply for grants together, not agencies doing it individually. So we really try to have more of a collective mindset when we can.
Thank you. Thank you so much for that. And I want to be mindful of time to make sure we do conclude at 1 o'clock. What I'd like to do is I'm going to mention the final question that's here in our box. But while I do that, I'm simultaneously going to pull up my screens to show you the evaluation link, and my program assistant will also put the link to the evaluation in the chat box. And so while that is up and you're opening that link to do the evaluation, I'll see if Mark could possibly chime in on this last question. So we have someone who asked about difference in recruitment and retention and program stability if schools are contracting with community mental health agencies or if they are hiring school mental health professionals themselves. And so it sounded like in your school district, there's a lot of contracting that happens, but if you do just either from your own district or your experience from the field, have anything to say about how recruitment and retention may differ in those two scenarios, I'll ask you to pause for just a second while I share, and then make sure that that evaluation is up and available for our participants. So, okay, and I'll hand it back over to you, Mark, for that final.
Sure. Yeah. So I think, for me, there's part of it's about what's the work going to be. So in, at least for us in this large metropolitan area, we have really stayed with contracting using mental health agencies that are hiring their own employees that then, Minneapolis or other school districts are partnering with to embed in schools. For me, it's just a really clean way to keep kind of the clinical work done by the agencies. I think when you start hiring school-based mental health clinicians as a school, I think that you've got to get clear about, well, how is their job different than a school social worker job? And so I think as it relates to retention, I've been really impressed with some of our agencies who just really are really good at recruiting clinicians of color and supporting them. And that's a part of the work that they're really impressive at. And so I think when you get into district hiring, that could potentially be more of a challenge depending on the size of your district. And then I also just think sometimes agencies have a little bit more flexibility. So I think it really depends on what do you want the role of that person to be is your first decision point about should it be contracted through an agency or hiring on ourselves. And then there's different kind of retention and recruitment things that play out because of that decision.
Thank you so much for helping to squeeze in the answer to that last question. And unfortunately, that's all the time we're going to have for Q&A today. Again, a huge thank you to both Mark and Nikki for sharing tremendous expertise from the field on this topic. And again, before you go, if you could just take a couple minutes to complete the evaluation form. This is required by our funder. The link is provided in the chat, and if you go to that link, it's just going to take a few moments of your time. When you get to the end of that evaluation form, there will be a link to a second form that includes a couple of additional questions that our center likes to ask to get some additional feedback to continue to improve the trainings and technical assistance we provide. If you do that second form, trying to click forward on my screen, you will be able to download a certificate of attendance for today's webinar. So I encourage you to do that. And one final note, please again be on the lookout for an email from us in January with the report that was mentioned today that will be summarizing recruitment and retention strategies for the school mental health workforce. Thank you so much, everyone, and I hope you have a wonderful rest of your day and week.